Hi, I'm Associate Professor Susan Moloney and I'm the Director of Pediatrics at Gold Coast Health. There's no doubt that immunisation and vaccines have saved countless lives worldwide over the last 80 to 100 years. We need to continue to have high rates of vaccine and immunisation for that to remain sustainable into the future. We have a child up in our intensive care unit who's acquired measles due to not being vaccinated. As a result, they've got widespread brain damage, they've got swelling of the brain, seizures, what's called an encephalopathy, and will no doubt have long-term brain problems for the rest of their life. Measles is a highly infectious disease. It's one of the most infectious diseases we know, and if you are not immunised and are in contact with measles, you will get measles. We have fairly high uptake of measles immunisation in Australia, and as a result have minimal spread of wild measles. We do, however, have many non-immunised people travelling overseas and bringing measles back into the country. If they are in contact with someone who's not immunised with measles, they're very highly likely to acquire measles. This is preventable. If you as an individual are immune to measles, you will not acquire measles from someone who's carrying it into the country. And sometimes these people are asymptomatic for many days before it's obvious that they have measles. Measles is one of many vaccine preventable conditions in Australia. We immunise against a large number of bacteria and viral infections to prevent you as an individual and also to prevent others in our community who are vulnerable from getting these diseases. We also at the moment have 3 children in our ward who are severely immunocompromised or have a very poor immune system due to treatment with chemotherapy for childhood cancers. As a result, they are completely non-immune to any of these conditions and we can't give them vaccines because the vaccines won't work. These children are highly reliant upon you and I and everybody in the community having high vaccine rates so we don't have circulating viruses in the community that can then go on and cause long-term problems to these children. So if there's one important message I can give to you, it's that please ensure that your children are immunised with the appropriate immunisations. This will protect themselves from death and consequences of vaccine preventable conditions, but also it will protect those vulnerable people in our community that we need to protect as well.